So neurodiversity in general just means thinking different. Neuro, the brain, diversity, right? So there is no one person who's like the other. Even as we sit here, none of us is the same. All our different elements, when you're looking at like autism, that's why it's called a spectrum. Even with ADHD, it's different. We have ADHD, ADD, or the full attention deficit and hyperactivity disorder. And it never comes alone. It comes with cousins, friends, and as you grow up, you acquire them in the process without warning. Like I said, we got one acquired yesterday, this week, and you're like, I thought I had just crossed the adolescent mark and I've figured everything out. Then you realize every day comes with something new. So I'd like my team to introduce themselves. We'll start from here, moving that way. And as they introduce themselves, they'll tell you who they are, what they do, and what's their neurodivergence, their diagnosis, and at what age that they got their diagnosis. So, and I want you to have a very open mind. Even if we're talking about diagnosis, I know other disabilities, it's like you just get it. You know? Ours, there is a story to the story, and why we are going to change the panel a bit. All right. Okay, I missed a step because I have already realized there is a missing item. So what makes it different when you're looking at assistive tech? For us, our support system is not as simple as I give you a braille and you're fine, right? It's not as simple as I will give you a white cane and everything is fine. So I have a box here that represents multiple solutions for the multiple elements of neurodivergence, and everyone has what works for them. Yeah? All right, you're good. Perfect. So this is called a sensory kit. All right? For the neurodiverse, the environment really matters. It is what makes or breaks. It is what determines how well and how comfortable and how responsive or hypo a person will be. So now that my panelists are comfortable with whatever works for them, I think we can take it from the top. Over to you, Lam.
Good morning. My name is Lamek Derito. I am a youth lead at Ability Inclusion Alliance, and I just saw my team walking. Myself. To begin with, I would love to say what I want to do, but in my head, I don't really have it figured out yet. And that's just the truth of it. And that's the reason why we're here today. But then again, I don't also do nothing. And regardless of everything that there is, the much, the less, the in-between, the ups and downs, the overload, all of it, we still stand here today. And in our identity as individuals within the neurodivergent space, this room feels friendly right now because in my hand, I have a fidget spinner. I am not fidgeting, but in my toes, my feet, I bet you, my toes are curled up. You can't see that. Only I know that. You'll see me spinning something. If I had this pen in hand before, you saw me flip it. And sometimes these are what are you doing? Quit that. Stop it. You're distracting. I am not. I am simply existing in myself. And in what I am becoming, I am finding my identity personally and professionally. And I stand within the neurodivergent space as an advocate and as the voice I wished I had as a young person. And I stand in that gap to feel it. And I'm really glad to sit in front of you here because this is more than a prayer, this is more than a blessing, and this is just identity in its formation at its best. So there's a lot to unpack, but to give a quick introduction, my name is Lamek Nderito again. And there's more to unpack. We'll talk.
Over to you.
Good morning. My name is Paul Mugikizaka. I'm commonly known as, I sometimes call myself the autistic lawyer, just because I'm both autistic and I'm a lawyer. First of all, I'm seeing we have that 7 minutes remaining, and would love to tell the people organizing this, our people can stay, the audience are willing to sacrifice 20 more minutes for their lunch. So you can look it up. And then, or will you not sacrifice? You will. Thank you very much. So,
When did
Okay,
you get your
sorry.
diagnosis? When did you get your diagnosis?
Okay, thank you very much.
And which diagnosis?
So, I was first diagnosed when I was 3 years, then later diagnosed when I was 14 years. I know it's kind of, you're wondering how. So, when I was 3 years, I was diagnosed, but during that time, there was that assumption on who is autistic, who is not autistic. And then I was further diagnosed when I was in high school. And when I was in high school, I was overly medicated. I'm one of those products of medical model. And then in 2023 is when I discovered autism as a disability aspect. That time I think I was in my third year of education of law school. So that's how my life is. I like traveling a lot. I like researching. I like interacting with people. And yeah, that's it. I think when the other time comes, I'll remember other things about me. Thank you.
Hi, good morning, guys.
Good morning.
My name's Arsara Bosibori Bitange. I am a person with autism, ADHD. I am a disability advocate. I raise awareness for people living with neurodivergence. Yeah, I'm a creative. I'm both an artist and I also pursue ICT, looking into cybersecurity. Diagnosis. I was diagnosed with autism at a very young age and later diagnosed with ADHD. Yeah, I'm really excited because I don't think we've had a session such as this in the Inclusive Africa, and we're really grateful that we are actually the pioneers of the first neurodivergent conversations. Because yeah, good clap. Yeah, I'm really excited again. I'm sorry, I'm fidgeting. Yeah, I know this is the works of autism. This is actually the real life. Yeah, so what did I miss?
You're good. All right, Jeffrey, over to you.
Hi again, I'm back. I'm Geoffrey Karani. I'm 24 years old. I'm dyslexic and I'm proud of it.
What do you do?
Now? Now I'm currently working as a teacher in a special needs school, the same school that I went to. So I completed my education level in that school and I decided to go back again to give back to the community and show the kids that I've been through the same journey and I made it. So if I did, they will also.
All right, and what's your diagnosis?
Dyslexia.
Perfect. So now we understand our audience, where they are at in life and what diagnosis they're working with. And I want us to start with the side that is the oldest, that is the health element, apart from the diagnosis. How was that journey for you in the access to health, access to intervention, access to support? We can start with Geoffrey.
Again?
Health, in the health space, yeah? How was your experience in accessing health? And early intervention, because for a neurodivergent person, early intervention means everything. There is something called neuroplasticity, which means you need to work within a certain time frame to be able to have very impactful results and also management of some of the characteristics of something. Let's say autism when it comes to speech, when it comes to mobility, when it comes to sensory integration. So for you as a dyslexic person and having gotten your diagnosis at 14, yeah, how was it for access to health and support systems at that time for intervention?
Back then, actually, many medical hospitals couldn't understand this kind of disabilities, because normally people look at physical things, you see, and I'm dyslexic, it's inside here. The only person that can notice it is a teacher sitting with me in a class. So it was really hard because I also remember I shifted from many schools actually, a lot, because there was a lot of bullying. Sometimes I'd wake up in the morning and be like, oh my God, will the day end with me being alive? Because we normally have this mentality whereby education is key to success, you see. And I normally ask myself, is it possible that the entire world, everybody inside it is perfect? Everybody's a learner. There's no way. So I had to push through that situation, from one school to another, hospitals, this and that, and eventually I came across this special school back in the day, and my mother had no choice but to take me to this school, and from there on, that's how my life changed. Now I can read, now I can write, now I can type. My life has completely changed.
Okay, perfect. Sarah, how was it for you?
It was a bit like his. I don't know if I can say my age, but nowadays people share the age. Yes, I'm 32. I just turned 32 last month. It was hard early in the 2000s. We usually, I was born premature. I forgot to mention that I also have hemiplegia, which is a bit, it's on the spectrum of cerebral palsy, which is really mild. So my left side is shorter than the right side. And they had noticed that I had missed some milestones as a child. That's when I was diagnosed with autism. And then because back in the day again, there wasn't really psychosocial services or counseling for our parents. So our parents were left out to kind of figure out, like, your child has autism, but the therapy, the schools or places where we can be given for therapy. And she was told that, I think back then, obviously, in Kenya, most of our parents are, there are different phases where you go through. You go through the denial phase, which takes a while, and then now close to the acceptance. So I think my parents were in denial for a few years. And then, it's still a question, it's still a topic to actually talk, it's still a topic that should be talked about, because even right now, there's so much in terms of support in health. Yeah.
Okay. Paul, for how accessible is diagnosis, therapy, and early intervention?
First of all, just a question. Who has ever taken 5 to 8 tablets every day for 8 years?
Okay, I have
my partner.
Karen.
So, for me, the story is quite different. I'll speak when I was in high school. I went to one of the most prestigious schools in Kenya. And when I was diagnosed, because that time is when you're convulsing, you're shutting down and everything. And at first I taken to a neurosurgeon because they thought it was a problem with the brain. And then all of a sudden they were like, no, take him to see a psychiatrist. And then the psychiatrist is like, you have autism. The parents are like, no, he's bright. I had a cousin who is currently in her 40s. She's low functioning, so hers was autism, mine wasn't. So you were kept on a comparative level. So it's all about take your medicines, you'll be cured in a lot. You'll be cured one day, one time, God will cure you. That was all I could say about mine. So, and I still believe it's there. Actually, it's there. I've had cases about it. So, yeah.
Okay. So that highlights that there was comparison between you and your cousin because you are high-functioning autistic and she was a low-functioning. You are not considered autistic, but you are being medicated because you are behaving in a certain way. Okay, so that just highlights how stigma arises from the different and expectations to fit in a certain box. Paul, Lamek, on your side, what do you feel that the main barriers are in healthcare for families who are neurodivergent?
I would say the main barriers, the lack of knowledge too from parents, because if a parent believes the teacher, when the teacher calls the child msumbufu, a very violent child, stubborn, a distraction in the class, but it's just a neurodivergence, because there is that term of it. And to take away the clinical bit, as he said, there was the clinical bit. So the barriers, as I can say to myself, I am unassessed as it stands even now. But how I come about this is because I know there is more to what meets the eye. In my education life, there is more to what met the eye in terms of my isolation, in terms of social aspects, was my preservative of what I knew. There's my identity somewhere in there in this chaos. There's that preservative aspect. Clinically too, beyond the diagnosis of you're told you're depressed to some extent, I would say a barrier that I can pinpoint and say this is my main thing is the overlap between mental health, from whether be it the overstimulation, be it bullying, because as you said while beginning the conversation, any neurodivergent condition on the spectrum comes not solo, it comes with cousins, it comes with its other, it comes with the whole family, it comes as a get together back to you. And as a person, young, the parent doesn't understand you, your community outside doesn't understand you, the health bit clinically diagnoses you and gives you just medicine or calls you depressed, while all the while this is the effect, not really the cause. There is that thin line between mental health and neurodivergence, and the information is out here. As we all are in the current digital age, information is out there. But how well do you really understand this information? So I would say it is the dissemination of that information to parents and the sensitization of teachers coming to education, because there's so many people out there, me being one of them who sits here. I've gone through 3 high schools, and in Kenya, a boy who comes from the Eastlands, you are not really a boy to dwell in school and thrive peacefully, because your resistance is more so a moral consideration. It's not really your operational and just your authentic self, because you're blatant. Honestly, you don't take infringement of your space, respect nicely, because if you feel there's more to what meets the eye than what is being seen, then you feel that need to really preserve yourself. And so that bit brings now the mental health. Now you'll treat me for depression, anxiety, and really overlap and not see any bit of neurodivergency.
Just to add on him, and one talks about how these medicines makes you high, and it makes you feel lazy. And sometimes it was so hard even buying these medicines, because you find they're not even readily available in most pharmacies. You have to go somewhere else to buy it. And then they look at you, they look at the prescription, and they're like, are you sure this is for you?
Yes, I get you. Just to relate with the same, because I know for me my diagnosis was late. I think, when I turned 40, when I started looking into what my kids are going through, and the more I read about autism, the more my life, what I had gone through in the past was like rolling out. But then I couldn't identify where exactly. And there is a difference in the diagnosis of an adult and a child. For a child, the diagnosis is done by the neurodevelopmental pediatricians and the pediatric side. For an adult, it has to be done by a psychiatrist. And the cost is very exorbitant. Just to talk about the universal health care when we are talking about accessibility of health. And these are the things that can bury everything else. And like I said, there is an intersection. I remember at a point in my caregiving, I was getting palpitations, and I nearly went for surgery, and nobody was understanding why I was getting. So for me, the intersection was it the pressure from raising the kids on the spectrum, or was it me? But later on, that's when I got to learn that actually it was ADHD with anxiety disorder, because you have sleepless nights, you don't know when the seizures are coming, you can't fully sleep, you have to be on high alert with everything. So your body is never fully on rest mode. I don't even know when people say they're not thinking of anything. That makes no sense to me. When someone says, and I'm like, what are you thinking about? Nothing. I don't know what nothing is. Like, what is nothing? That is one of the hardest questions. Or like when my son, who's nonverbal, is just there, I'm like, are you understanding me? Are you like, what are you thinking? You know, are we together? You know? And this makes also the education space very, very difficult, because you're in a space and we're all different learners. For in the neurodiversity space, we have kinetic learners, the ones who learn as they move. We have the tactile learners who have to touch. We have the audiovisual learners. So for me, I'm an audiovisual learner, but then our education system changes from very accommodative. When you get to high school, it becomes complex. But then, due to lack of IEPs and understanding, you're getting to a point like, I was a high performer. We go to high school, I'm in the top school. Let me use the statement people hate. I went to Alliance. So there are expectations in life. You have to be a doctor. My doctor is not the medical one. I was actually disowned by my father because I refused to go to do medicine. I had to school myself because I'm a creative. That's my neurodivergence. Anything to do with hands, eyes, viewing, touching, creating, I can do it. I can never lack a job. I can construct, I design, I knit, anything. I paint, I draw. That is how wide our brains are. But then you see the education system wants to box you, and I want us to shift to that element of education, because how we learn affects how the rest of your career is going to be. And sometimes when I look at employment and opportunities and they're capping the age at 35, I'm like, do you know I just discovered my career like when I was that? So now you're locking me out when I'm just discovering myself. So for the policymakers in the House, please note, as you put in retirement age, also put support age to vary. Okay, so I'll go over to Geoffrey. Tell us, how was education for you, especially being dyslexic?
It was never easy, because I grew up not in a city, in a village, whereby teachers never knew anything about any special needs child, especially dyslexic. Because as I repeat and I'll say again, when you look at me physically, I'm okay. But if you sit down with me in class, you'll notice there's a problem here. So coming from a village and also coming from an orphanage, it was really hard for me, because people would bully me for who I am, and people would bully me for not being able to sit down in class, read and write and all of that. So there was that back and forth thing in school. So I remember I was always told that I was good in speaking English, but the rest I wasn't. Every single time we would do an exam, it was the worst day, because I would ask myself, okay, these people are expecting me to perform better. You know, I'm in a big public school whereby nobody understands me, and nobody ever thinks of putting me aside and asking themselves a question. What is wrong with this child? Physically he's okay, he's walking, he's laughing, he's playing. There's something is wrong. He can't read and he can't write. The worst part is when they realized I couldn't even write my own name. Can you imagine living in a world whereby you can't even write your own name? You know, I used to believe this is my name, but people would say, no, this is not your name. And I remember my mother once told me, the day that you will learn to write your own name, I will gift you something. So I had that motivation, like I want to learn to write my name. And ever since I joined this new school in Nairobi, and I remember the first teacher that taught me was Nancy, the director of the school. And she taught me how to write my name, and she told me, this is your name. I was like, no, you're lying. This is not my name. This name is too long, you know. And in order for me to get used to writing my name, it was not easy, because I had to start accepting. And it was not that easy, because you're in a village whereby many teachers are just from local places, you know. They're not well equipped. They don't know what to do, you see. I was always taken to the hospital, but I was always okay. And I do know that there's still some kids outside there in these same schools suffering through the same thing. The problem is nobody's there to discover them and give them a second chance in life.
Right. So we've seen how the system and the difficulty in actually getting the right support system in our education system. So Sarah, do you believe that the systems that currently exist are supportive to the neurodivergent community?
I feel we still have a long way to go. Why I'm saying this is, even me, I grew up, I went to a school actually, I went to a mainstream school, IGCSE, I did my IGCSEs. So they discovered like I was late in learning, like I was, the word was, I was a slow learner. And they had to, before I transitioned to a special school, they had a small, cramped up special unit, which just had one teacher, and it was very chaotic back in the day. So for that transitioning, it was really hard. First of all, not so many schools are cheap. Not so many special schools are cheap, because the ones that are there are public, and mostly, frankly speaking, some of them are very cramped up, and most have teachers that are like maybe fatigued because there's so many children, and it's just one person that's taking care of these kids. So there's also the aspect of negligence. So my parents, thank God for them, because I wouldn't be here if it wasn't for them, their support. I traveled all the way to a place called, me and my mom traveled all the way to a place called Meru. It's in the central province, yeah. So it's just been a journey. It still needs a lot of work. Because I also have a background in, I went for an internship, and I was an assistant vocational trainer. So I came to learn not only from my experience, but from the experiences of the children. So it also gave me an extra, strength of knowing now, since, like, yes, I've passed through this experience myself, and I know how hard-headed I was. I was very, hyperactive. I could not sit still. I could not read or write. And then now I'm teaching a fellow neurodivergent like myself who's younger. It's a humbling experience for me. And yeah, it's hard because people tend to say, there's a look for autism. I'm like, wait, how do you know there's a look? Autism has no look. It's a spectrum. So I actually think it's not offensive. I used to get offended by it, but for society to get to learn about us, we have to teach them. So yeah, that's why we're here, and I'm glad to be part of this panel again.
All right, thank you very much. So I know when you say you're a lawyer and you're autistic, everyone looks like, oh my God. So how did the system favor you so hard that you are able to get where you are when we're looking at this box we're trying to be put in as autistics and the things we should not be able to do? So
first of all, I'm going to tell you what you should try not to do, actually. I went through some things which always say, do not do it to the future leaders. So there's this thing called masking, where you pretend everything is okay. I perfected it, but it really messed me up in the future. But I can say, let me just say a good thing about the prestigious school I was in. We used to have this thing called voluntary service scheme, where we used to call it holiday jobs. During the holiday sessions, used to work with. I remember I was one of the first people to work in a court, a law court, and when I was in, as you call it, Form 1, Form 2, there are 4 forms. So when I was in Form 2, I went to Makadara Law Court, since it was the nearest public institution. And I think that's where I met most of my mentors. I still do remember them: Honorable Kibosia, Justice Ominde. Also had the chance to meet and work with the Chief Justice for a short amount of time when she was back at the Court of Appeal. And I think with that mentorship, I got to have a passion in law and knowing the end results. So despite I saw the end product. So despite the hard times in law school, and I also thank God for AI. When people hate AI and speak bad about it, I loved it. It was easy, just put in your notes and tell them, summarize it for me. And it gives you those summaries, and you go look at it, so that when you read those long notes, at least you have an understanding, what are you reading? So I thank God for the mentorships programs and everything. So that is my life generally. So when I speak about prior learning, just know that is where I come from. Yes.
So, Paul, you've shown us how mentorship, if you had not been exposed to that holiday working space, law would not have been your natural choice. And this is now to the caregivers, because I know we are protective with our children. We cannot tap that potential unless we expose our children to the greatest version that they can be. So I remember it was a LinkedIn discussion and someone was like, at least there is nothing like at least. You know, we need to be given the highest level, to be exposed to everything, not the lowest, whatever you think. You cannot cap someone's brain. We want Einsteins, yet we are not exposing them to the Einstein level of education. So, Lamek, you are finding yourself, and you've been finding yourself for a while now. So how is that going?
It's correct to say I've been finding myself since the moment I realized, I'm alive and I'm my own person. And I'm finding it better now, because initially it wasn't so. I'm going to crack a dry joke. My intervention needed intervention. Yes, my intervention needed intervention, because how I was perceived was the person who can stay still. You see the smart kids who want to distract others. I do not, because I know I'm not going to study. You guys might as well as go on, but I'll be drawing over there. I'll be making rounds within the school since it was a boarding school. But then, watch out to angel. Let you be caught outside. The TODs. This is where the clash comes in between us, students and teachers, and trickling down to education. This is where, quote unquote, my resilience is perceived as infringement to authority, disrespect to authority, disregard to authority, my blatant questioning, because why do you want to cane me? It's not that I know corporal punishment was abolished, but clearly within the stipulations of the school rules, I haven't broken a rule. I was thirsty. Is it a crime? Dare you tell a teacher that? Who are you to say that? It was just an honest, blatant question. Hey, namna this, namna that, you're suspended, you're expelled, you're punished. My time for education, which was time for school, is not really taken into account in class. My identity was built around masking, because everyone outside of myself does not understand me. To further exacerbate my identity formation, I had encopresis as a child. Encopresis is like the fecal incontinence of bit. If a child pees on themselves, overload and everything, that subjected me to ridicule, bullying, them calling. That bit was now the mental bit of my identity. So I have discovered myself through going through a clinical journey of mental health, being told I am depressed clinically, being put on some antidepressant for some months while in my last year of school, while in my third school. So it's my last year of school here in Form 4A because it was really quite a journey. And here I am, here I stand. So my identity is formed around that crisis, but then my resilience has always been this. There's more to, and I keep repeating that, there's more to what meets even my IB for a mirror, because even formally, I couldn't even recognize myself. In a mirror, I had no image of myself. That's how bad my masking was. I can't create a mental picture of myself. I don't know who I am. I know my name, yes. I know my identity, yes. But who am I? I don't know. So my existence is just around that. But then how I am coming up and this identity I'm creating is not also a neurodivergent as a person or as a name. It's not that. But it's really just the existence of me who is here right now. So professionally, my education around that informed my advocacy, my disability championing, because as Geoffrey said, you really can't see this side of disability. You can't. And by just taking it at face value, it needs more than face value. And this is how I come to be. This is how I still come to create my identity. Formally, assessment, I haven't gotten an assessment, but still, I am in this journey. And I like it because look at where I'm at right now. The person who's been suspended, the person who's been expelled, here I am.
That's amazing. But you all can see how heavy the community, the environment, our education system is really forming the rest of someone's life. Those small accommodations that we lack to do when we are young. Now, I want us to move over to the theme of assistive tech. I know you mentioned, Paul, that you like the ChatGPT, you and I both, because the pressure that I was facing in high school was like, I have to listen. I have to involve multiple senses, that I have to listen, I have to write, I have to still remember. Yet there's something in between I didn't get. I'm supposed to continue, yet my body and mind is on freeze mode. So you have to play double catch up, sacrifice your sleep so that you can be able to figure it out. And for audio learners, like he said, he was a kinetic learner, but then he was being punished for being a kinetic learner instead of getting the support that he needed. So for the tech element, what, other than fidget spinner, what assistive device works for you best would you like to enlighten the community? Because what you find is the basic things you think are toys, for us are very high assistive devices. Learning support, how we learn numbers is as simple as, remember I introduced this, this is our sensory kit. This is as simple as how you will teach a child how to sort colors and to identify. When I look at my son, when we sit in class and they're like, this is yellow, and you want to follow a sequel, he will not. But the minute you throw a random color, he will tell you which color it is. But in class, you're being forced to 1, 2, 3 follow themselves like this, and that's how he has to do it. He can sing it to satisfy you, but is he really understanding? When you're looking at the ones with issues of fine motor, like she said, she was having issues with fine motor, something as simple as a tri-pen. This pen, the size of it is not your regular size. This pen, has something we call grooves. These are the grooves that help and guide a child on how to hold a pencil, and it only has 3, not the 7 angles of the pen. These other ones are called pencil grippers. This is how you train a child on how to hold a pen. Because the default neurodivergent pen holding is this one. Or like if you're like my son, he holds with the right, he gets tired, he goes to the left, and you're like, which side are you? Are you watermelon like someone we know, So when I was sharing stories with him, he was saying the way the environment gets so overwhelming. And we are finding that. We want to be in session, but sometimes it's just too loud because we hear everything. I can hear a fan. I can't see it, but I can hear it. Can anyone else hear it? And it can really mess me up, because I'm trying to focus, The first time I entered this room, I'm looking at my tablet and I'm seeing the reflection, and I'm like, how am I supposed to be reading my gadgets? I have to angulate things. I know Paul cannot take flash, the flash photography. Something as simple as noise cancelling. You find someone with headphones, you're assuming they're being ignorant, they're not listening, but they have to cancel out all the noise so that they can be able to focus and just muffle it down to what they need. And when you're talking about bells, I'd rather have my hourglass that I can see. without the noise that I'm not getting on, then you're like, oh my God, the world ended, you know? And that's when we're supposed to be changing classes. That individualized accommodation is what we seek. Something as simple as teaching me colors using this. Teaching me fine motor skills by I have to move it, that means I have to exercise my hands. So our assistive devices and our assistive tech is a bit different. And that's why I wanted to talk about that. You've seen how multifaceted neurodivergence is. And with that, I wanted to bring about our NeuroREHub, which is what we were talking about today. That is an app that it has taken me 5 years to put together, of research, of the journeys and the things that I'm going through, and understanding, engaging with neurodivergence and parents. I think it had come up, if whoever was controlling can do that for us. So it's currently on Google. And we have a web version of it where there is general information. I know like the corporates say you cannot understand neurodiversity. We've broken it down, the different neurodivergence, what to see, how to accommodate, how to support. Because as parents, the minute you get that diagnosis, your mind goes blank. Where do I go? You're going through your process of personally internalizing while the time is moving for that child to get their early intervention. So we become a hindrance not by choice, but by the process of trying to. And when you go to Google and all you can see is your child will not be able to, it drives you crazy. So we've tried to package it and prepare you mentally. As a parent, this is where you go. What schools are there? How is the health system? How is the government support system? And also over and above that for the neurodivergent, you have your calm down. For me, like when I go to hospital, I'm asked, when was the last seizure? I'm like, I have 2 kids with seizures. How am I supposed to be tracking that? So we have that tracker, medical reminders. One of my kids takes, like you said, 8 tablets. Like now we have one that's alternate days, other than the physical, organizer for medication. There is just a lot that you have to handle when you're taking care of a neurodivergent individual, and also for themselves. And that is what the essence of the Neurodiversity Resource Hub is. And also the app, so whichever works, whichever tickles your fancy is there. And we also, as I mentioned earlier, Andy Speaks, we came up with the Neurodivergent Society of Kenya, where we want to build the voices of the neurodiverse. Let them be able to be there and speak for themselves. Let us be an icon for our other upcoming children so that they know you can be somewhere. You can be that, whatever it is that you want. If you delayed, you're late, whatever the case, you will still get there. And in closing, just what's your assistive tech and what's your one message of what you'd like to see changed?
ChatGPT sometimes feels like, if you've watched Baymax, Big Hero 6, Baymax, the intersection of Baymax and Jarvis from Iron Man. And that by itself could be a very good thing for a neurodivergent person. So ChatGPT.
I like the way you went technical. Atija what?
Jarvis, Iron Man, Tony Stark, Jarvis. The system, he comes in and be like, Jarvis, do this. Baymax is the help bit of it.
All right.
Neuroformative.
Thank you for educating us, Paul.
I always, just like the way ChatGPT always say with neurodivergence, and also part of universal design, the principle of simplicity, simplified versions. Even if now in the legal areas, in laws, I can see Justice Laibuta here, and all I say is they do write long pages of judgments. And you find that you want to know what case they referred to and everything. And and also in terms of learning, when you put simplicity in it, and then also affordability, because sometimes these features are not affordable. You have to have a phone, and a working phone you have to have. Sometimes right now, thanks to capitalism, you have Plus, Pro, and all that. And you look at Pro, you see it's like around $300, and you're like, what the hell? So yeah, the principle of simplicity, and hopefully soon it should be affordable. Thank you very much.
Right, Sarah.
I would say the same. AI, ChatGPT, DeepSeek, it has always helped me in terms of like my work, creating, advocating on social media. I do both Instagram, IG, TikTok. It also helped me when I was in school, when I had like a short time at KQ internship. I did cybersecurity. It was also in partnership with MasterCard Foundation. If you know KQ, unajua, they lipa vizuri. They have nice payments. So the same as MasterCard, because that last year I was like a baller. And I felt nice. That was like my drive of going like now into the employment sector. So what I can say is let's come together because we're a community. It might be your sister, your cousin, your friend. When you see a neurodivergent, just remember that you saw Sylvia, you saw Paul, you saw this other nice gentlemen here. Sorry, I've forgotten their names. Yeah, so yes, just remember that we are here and we're a community, and yes, it's manageable, and yeah, that's it.
All right, Geoffrey?
Yeah.
So I also normally rely on ChatGPT because as a person with dyslexia, I still struggle to read some words. So even typing, sometimes somebody might type something and if I don't understand, I just go straight forward to ChatGPT and it gives me the answer. Yeah.
I love voice to text because I'm an orator. I prefer to speak. When you tell me, write for me this, and I'm like, we have to engage too many elements of this brain. So let me just speak, you do the writing. I will correct after. I'm a perfect editor. My first job was in a publishing house, but then starting that article is always very hard. And that's why when people ask me, when are you writing a book? I'm like, when I find someone who will be able to interpret all my interviews into text, then I can arrange it in the chronological part. So thank you very much for being with us, and we hope that you will be able to spread the word. Neurodivergence is just part of life. Because in the disability space, we always feel marginalized under the marginalized. Even our assistive tech, or how to get understood to be able to be supported. Because of that, different elements, we have the behavior side, we have the speech side, we have the sensory side. It feels like a lot. But just think of us even as you're trying to make the things accessible, because we are part of the community. We will always be here. And with the numbers rising with 300% in the past 10 years, what does that tell you? It's about time we become part of the conversation from the word go. Not just a thought after. You're designing a program and you're like, by the way, these people are different. If I was to ask Miriam here, how are their We Can Work program has gone? Because we cannot be taught in 6 months. Well, our education system, as you had, already failed us 10 years ago. So when we are starting, even if it means having a separate program for the neurodivergent with the same goals, we are always ready and available to support and tell you what can, what cannot work, what works for us. And like you said, none of us have the same, challenges. It's in the same space, but the diversity in it is also diversity, right? So Paul was saying about
one thing. Also, when it comes to neurodiversity, we hope for a multi-sectoral approach. I'm going to give an example. Kenya, we are the first people to they have brought an autism management bill. I remember we went as Neurodivergent Society of Kenya, Dr. Sylvia there, to Parliament, and we told them we cannot just entirely be kept under the Ministry of Health. We need a multi-sectoral approach. We need education to be involved. We need social protection to be involved. We also need health to be involved. We don't, because when it comes to neurodiversity, something we have seen is that there's a fight. Because you have, right now we are here, psychiatrists are in another room somewhere. They had a conference this week. They're now speaking about a new drug that they want to keep. And now you have a lot of sides, someone says, and then you have a lot of theories. Some people say weed cures neurodivergency, that just smoke marijuana. There are people who speak about camel milk. There are people who have a lot of theories around it. So if we happen to have a multi-sectoral where we tend to learn and see how we can be accepted into the society, because that's the end goal, because the competition, sometimes the people who are hurt are us neurodivergents. So
Thank you.
Thank you very much.
All right, we are like out of time times 10. So thank you for being so gracious to continue sitting. I know it feels so short. We can spend a whole day on neurodivergence. It's as diverse as it comes. So thank you very much, my fellow panelists and my people, and also for the courage to come out. Like we said, it is the first one, so it means a lot. And we hope that we will be able to have this in a bigger platform, more detailed and more time if possible. Thank you, all of you.
Thank you.